Okay, hi. My name is Vivian Ramsey, and this is Victoria. Welcome to our presentation on the deconstruction of the romanticization of OCD. So, as some background, my name is Vivian Ramsey. I'm currently in my second year at UAB, and I'm a sophomore majoring in neuroscience and medical sociology um, on the pre-med track. And the reason I joined Mental Health Ambassadors was because I really wanted to raise awareness about a lot of stigma surrounding mental health and kind of break that stigma through an organization that's honestly been amazing about raising awareness about different topics, from things like self-care with like a lot of different events to the presentation team, podcast, and more. And I've also hoped to explore different social issues as they relate to mental health, and from dark humor to the romanticization of different mental illnesses. And it's honestly been a wonderful experience so far. So,
My name is Victoria Terrace. I am a sophomore here at UAB. I am double majoring in philosophy and neuroscience, and I became a mental ambassador similar to Vivian because I wanted to raise awareness about what different mental illnesses are and how they can present themselves, and hopefully provide a path for resources for more people.
okay, so before we continue, we do have to clear some things up about what UAB mental health ambassadors are. So what our ultimate goal is that we hope to educate and bring awareness on different mental health related issues and topics, um, to our peers, and to be a peer mediator and advocate for mental health related resources on campus. We are not counselors. We can be a source of help, but we should not be your main source of help. For that, we encourage seeking out the mental health resources on campus, or seeking out professional help outside of that. So, thank you. Okay. Um, So, just to reiterate more about what UAB mental health ambassadors are, we really strive to promote the importance of maintaining good mental health. And as I mentioned earlier, this has manifested itself in many different ways throughout the program, including the podcast team and the social media team and the presentation team, and like all of the different ways that we focus on both applying mental health related knowledge and learning more ultimately for the betterment of your mental health. And this includes physical health, setting boundaries, and ultimately our focus is on being a peer mediator between mental health related topics, students, and the resources on campus. So, as a disclaimer and trigger warning for this presentation, it discusses some information that is sensitive to mental illness. Please consider take care of yourself and consider before watching this presentation if you think any of these topics could trigger you. Um, we are not trained mental health professionals. We're peer educators, as we have mentioned multiple times before, just meant to break the stigma around mental illness and raise awareness about the resources on campus that we have for mental health. Okay, so let's get into the presentation. So beginning, OCD, the romanticization. What exactly is it? What is the romanticization? How is it OCD presented in media? Why is it problematic? How is romanticization presented with OCD? So to begin with, what is romanticization and what does it mean to romanticize mental illness? Well, this is primarily dealing with an idealized version or unrealistic version of mental illness. So this can appear itself um, in many different ways, including making something seem better or more appealing or almost something to strive after. And this has been seen in a lot of different mental illnesses, from depression to eating disorders to OCD. And it's something that in this presentation we will be focusing on OCD, but it's important to consider like how this might extend to other mental illnesses and the way that you might notice it manifesting itself there. So, what is the romanticization of OCD? As I mentioned, we are focusing on OCD within this presentation. So, how does it manifest itself in OCD? So, there's a few examples that this has consistently been seen in throughout media, notably neatness or clean freak, organization, or so OCD. And topics like these tend to arise out of like this sense to feel organized and almost to feel like on top of things through that. It's not representative of what OCD actually is. So why do people romanticize OCD? Why do they turn it into something that it's not actually? So I mentioned a few reasons before, but to break it down into pop culture, lack of information, and inability to empathize. So in pop culture, I think this is the most common form or way that people come across the romanticized ideas of mental illness. Normally, it's meant to be relatable or humorous, something easy to laugh at, then to understand it, or sometimes it can even be seen as like cool. And this is problematic for many different reasons we're going to get into later. But a lot of the time, this becomes people's first impression of OCD, maybe. Like they'll see it on a mug, they'll see it on TV, and it really builds a fundamental misunderstanding of what mental illness, specifically OCD, actually is. This leads into our next point, which is lack of information. A lot of different outlets contribute to stigmatization, lack of understanding, and the romanticization of what OCD actually is. And a lot of time, people won't take the time to educate themselves outside of what they directly see through things like pop culture or news. So, you might think of maybe famous celebrities that have OCD, or you might have think of what you've seen in TV shows, or like I mentioned before, like on items like mugs or t-shirts. And a lot of people might think, oh, it's just being mean because it's what they most commonly see and what they see repeated over and over again. And a lot of the time, people won't take the time to educate themselves when they are seeing an idea of something that is portrayed over and over again because it seems like that's what it actually is if it's so prevalent. Um, and this ultimately leads to a misunderstanding that can then lead to an inability to empathize, along when combined with some of the factors mentioned before. So, moving on to the inability to empathize, um, through the above, um, a lot of people have grown to see it as like a relatable or humorous thing and don't consider the depth that like OCD might have on an individual, or the pain that they might go through or struggle that they might go through when they deal with that. So, through the above, like the relatability, the humorous, this widespread image of what like the romanticization of OCD, what it actually isn't, people don't understand what it is and they grow apathetic. They think it's just being clean. They think it's just being a neat freak. And it leads to like a generalization and an oversimplification of what OCD actually is. This leads to the failure to empathize and understand what it actually might be, like people who are actually struggling from OCD. Um, Instead, they're attributed these outside ideas from what people understand from pop culture. And then lastly, it becomes an easy source of humor for a lot of people, just thinking, oh, I'm so OCD, I'm so neat. And it's like relatable, but they also treat it as something funny. And this can really hurt people who have OCD because they feel like they're not being heard. Um, and it's become really challenging. And this kind of leads into our next topic, which is how does this affect people with OCD? So, going into this quote by Tony Nelville, it's like being controlled by a puppeteer. Every time you try and just walk away, he pulls you back. Um, and so, just to throw out a few examples of what you might have seen in pop culture, um, you might see something like this, which is like things not being exactly perfect. And people will say, oh, this is the toughest OCD decision of my life, or this is really like getting at my OCD. Or you might see characters in pop culture like um, the ones pictured here. Um, and so to go back to how this actually manifests itself for people who have OCD, um, it can show itself very differently from what we see from these characters. Like having quotes from actual people who have it reveal a very different truth than you might understand. Like an example of this is like this quote from Tip here, which is if having things out of place makes you fidgety, or the need for you to have things always in order, you probably have OCD. You're basically a perfectionist who can't stand to see anything out of place. But this is a drastic oversimplification of what it is. And so having this romanticization of OCD in pop culture and news tends to lead to a very dire misunderstanding that can then harm people in the end. So let's talk about some statistics. 1 in 40 adults have OCD, and 1 in 100 children are thought to have OCD. You are 10 times more likely to have OCD if you have prior contributing factors from genetics, environmental, neurobiological, and even there have been studies that trace it to communication areas in the brain. Um, and this leads to a large amount of people having OCD, but because of how it's portrayed in pop culture, because of how it's romanticized so widely, people might not even realize that they have it because they don't relate to what's being portrayed when they're struggling with it. So let's talk about some of these consequences, specifically the consequences it has on people who have OCD. So, like I mentioned before, there then becomes a lot of uncertainty and doubt about if you even have OCD because you do not relate to the image that is being portrayed by pop culture, by these articles that label OCD as something simple, like being a neat freak or needing things perfectly counted. Um, then there's a lot of misinformation that gets spread that you might also not relate to. A lot of these are very closely tied where you feel alienated because you don't relate to what's OCD is understood as, and you won't get the empathy that you deserve related to it just because people don't understand it as OCD because they don't understand OCD themselves. They'll see this romanticized image of it and they won't understand that you're going through something entirely different, but it's actually OCD. And these three tend to be really closely tied together and lead to a lot of suffering, or at least struggling, by people who have OCD. Um, and there often becomes a lot of confusion surrounding the diagnosis because people will joke about it, they'll trivialize it, they'll limit it to what they see in media, and it's harmful because a lot of people really suffer and have pain related to the OCD diagnosis, especially because it goes untreated for so long. And a lot of people don't really get that understanding. And there can be like a lot of internalized um, confusion or if the diagnosis feels right, because you never really get a full understanding of what it is if you only get that representation through pop culture, which is highly romanticized. Okay.
So for the next section of the presentation, we're going to be discussing what OCD actually is. Okay, so OCD is defined by the DSM-5 as a presence of obsessions, compulsions, or both. And the DSM-5 contains a list of criteria regarding what constitutes an obsession and what constitutes compulsions. So a general overview of what OCD is. OCD is characterized by obsessions that may or may not be accompanied by compulsions. Obsessions are defined by persistent thoughts that cause anxiety or thoughts that are suppressed by repeated behavior. And these repeated behaviors are compulsions. And compulsions are characterized by repetitive actions, and these actions are intended to alleviate the anxiety. So, in response to the obsessions, generally the sufferer with OCD will partake in the compulsions in order to alleviate some of the anxiety. So, doing the behavior will help the anxiety go down, and it creates a sort of vicious cycle where the obsessive thought leads to anxiety, and the anxiety leads to the compulsive behavior. And that compulsive behavior provides temporary relief, but in the long run, ultimately just reinforces that the obsessive thought was something to be worried about. That's what it said, what signal it sends to the brain ultimately. So it just cycles. And so there are multiple different subtypes of OCD, quote unquote. These subtypes are really just different obsessions and themes that different individuals will deal with. Some of the most common themes when it comes to OCD include contamination, symmetry, hoarding, harm checking, sexuality, and religious obsessions. And each of these have their own like core fears. where there are just different ways that OCD presents itself, where the sufferer gets this obsession and it causes them a lot of anxiety. And so to go more into detail regarding the different types, contamination OCD centers around a fear of germs and illness, and this is probably one of the ones that are most commonly known about. When you picture someone with OCD, you tend to think of someone who's very clean, aware of germs, and this is typically the presentation that people will have in mind. And similarly, symmetry is another really common obsession that people tend to know about, where the individual want things to be centered just right, want things really organized. And so some common compulsions for symmetry obsessions include organizing, ordering, and buying items in specific numbers. And this again is in response to the obsession and the anxiety. And a couple more different manifestations include harm checking, and this is where the individual is afraid of causing harm to oneself or others. And some common compulsions for this are locking doors and double checking that appliances are turned off. They just really want to ensure that they're not going to be hurting themselves or accidentally causing harm to others. And with hoarding, it is the fear of getting rid of something that is important. So some common compulsions here include holding on to old items and or materials that may no longer be used. And this is just to help the individual feel like that they're not going to lose anything that they might need in the future. So moving forward, here's some different things we can do in order to help put an end or at least decrease the romanticization of OCD. So we can work to reduce attention to pop culture materials that promote a romanticized or stereotyped image of OCD. So we can work to promote materials that are actually providing an accurate representation of what OCD is. And in order to do this, we can support people, pop culture, organizations, etc., that seek to accurately convey the reality of OCD, including people in our own lives who may be experiencing it. And then we can also just do research and discuss the actual effects of OCD on our own in order to educate ourselves. And here's some organizations, pop culture, and other resources that have more accurate depictions of OCD. So for the media, there are a few TV shows that are listed such as Girls. There are books such as Turtles All the Way Down by John Green and Under Rose Tainted Skies by Louise Cornell. Some notable figures who have spoken about their experience with OCD include John Green, Justin Timberlake, Nikola Tesla, and Howie Mandel. And as for media resources, you can look at the iocdf.org website, The Ip of the Mind by Lee Baer, and Brainlock by Jeffrey M. Schwartz. And some really prominent organizations that work to spread information about OCD include the International OCD Foundation, Beyond OCD, and OCD UK. And here are some ways to help/support a friend with OCD. You can be mindful of the language you use when talking about OCD. Avoid saying that you know what they're going through unless you have OCD yourself, because sometimes that can be harmful and almost belittling to them, even if it's unintentional. And be sure to listen to the concerns without judgment. This is because OCD is not a moral reflection of who they are as a person, and it's not indicative of their character. This is especially important with taboo themes such as ones surrounding harm or even pedophilia. And if your friend is supportive to the suggestion, you can encourage them to find a therapist qualified to treat their OCD. And here are some on-campus resources that you can contact for student counseling services. And these are the social media accounts for mental health ambassadors. Thank you.
So this concludes our presentation on OCD, but we do want to make you aware of the other events that we have going on this semester, including numerous other presentations that will be conducted throughout the month and the remainder of the semester, as well as other events, our podcast and social media. And we really encourage you to check those out for other mental health related presentations and just sources that might give you information similar to this, and like other educational presentations and events that are really important to mental health. So thank you. Okay. Um, we also have a survey. Please let it take some time if you see this, and it will be in the description below. Let us know how we did, and thank you.